This week on Africa
I know
Health Check.
coronavirus is an airborne disease that started from China.
It started in 2019 at China.
Ni ugonjwa tu iliyejitokea bila kujua.
We look into the possible sources of misinformation surrounding COVID-19.
Du coup, nous avons vu qu'il s'est installé une sorte de désinformation.
And one man's Nobel Prize to educate on the means of curbing the virus spread.
Cette pandémie.
Good day and welcome to Africa Health Check. This is the show that reflects on Africa's response to the COVID-19 pandemic. My name is Khokhontlejang Paladi, and before we dive into the discussions, let us have a look at Africa in numbers. This week, our Africa in Numbers segment examines the COVID-19 infection rates, especially as the new infectious Omicron strain threatens to escalate the pandemic. Data as of 12 December 2021 shows that there have been at least 8.9 million reported infections of COVID-19 and over 200,000 reported deaths in Africa so far. 11 countries have reported the Omicron variant, with Uganda now joining 10 other countries in Africa where the Omicron variant has been detected. These countries include South Africa, Botswana, Nigeria, Ghana, Zambia, Senegal, Tunisia, Mozambique, Namibia, and Zimbabwe. African nations currently account for 46% of the nearly 1,000 Omicron cases reported by 57 countries across the world. On today's episode of Africa Health Check, we dive into the discussion of misinformation surrounding the COVID-19 pandemic. We have seen so much information circulating on digital platforms as well as mainstream media. A lot of this information is unverified and is detrimental to the COVID-19 response. Today, we are talking about the effect or impact of misinformation on the COVID-19 response and how we as the community can counter it. We'll be looking at it from a scientific, religious, as well as a social perspective. My panelists for today, we have a special guest who's also our feature for this week. And this is Mr. Joseph Tsongo from the Democratic Republic of Congo, who is a social activist. I'm also joined by regular panelists and commentators of the Africa Health Check, Dr. Marianne Moreithi, who's the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya. Last but not least is Reverend Anthony Achempong, who's from Ghana, and he's a pastor as well as a pharmacist. Before I get into the discussion with my panelists, I want us to have this feature look at Mr. Joseph Tsongo and the work that he does in the DRC. Enjoy.
Alors, je suis Joseph Tsongo, je suis un citoyen congolais, âgé de 27 ans. Alors, je suis un activiste de changement social et je suis basé dans l'est de la RDC, précisément dans la ville de Goma, où je suis un activiste de changement social et coordonnateur de l'organisation Amani Institute Aspect. Alors, Amani Institute, c'est déjà un mouvement socioculturel des jeunes volontaires œuvrant dans la promotion de la culture de la paix et le développement des communautés à la base ici dans la région. Dès le déclenchement de la pandémie du coronavirus, en tant que jeunes proactifs, nous nous sommes lancés le défi d'aider nos communautés parce qu'il y avait un problème de manque d'informations au niveau de la base, au niveau des communautés locales. Et du coup, nous avons vu qu'il s'est installé une sorte de désinformation où les gens pouvaient inventer et dire des choses au sujet de cette pandémie. Genre, c'est des Blancs qui l'ont amené, genre, c'est pour nous éliminer, c'est des histoires. Et nous nous sommes dit qu'ils doivent avoir la vraie information et la bonne information au bon moment pour qu'ils sachent faire face à cette pandémie. Au sein de l'organisation, les jeunes leaders, nous nous sommes dit qu'est-ce que nous allons faire. Il y a aussi des conflits qui n'ont pas cessé parce que la pandémie n'a pas cessé, les conflits violents, l'activisme accru de groupes armés. Alors, tout pour néroter, nous nous sommes imaginé un truc qui va amener tout le monde nous embarquer, nous tous, les gens qui sont en conflit, les groupes armés, parce qu'eux-mêmes ne sont pas épargnés et la pandémie, elle peut toucher tout le monde à la fois. Alors, Tuponeote, ça veut dire, nous pouvons nous tous guérir, nous pouvons nous tous mettre nos efforts ensemble pour guérir. Et ça va passer par l'accès à la bonne information sur la pandémie de coronavirus et le message d'espoir pour les populations qui sont en souffrance, déjà qui vivaient dans des conditions en tout cas très fragiles, notamment les populations déplacées, mais aussi un message de paix, un message amener les gens à adhérer à la culture de la non-violence active sur terrain pour sensibiliser. Alors, déjà, il fallait une sensibilisation de proximité, c'est-à-dire approcher les gens et leur parler de bouche à oreille. Et puis, il fallait aussi utiliser les médias, notamment les radios communautaires au niveau local, parce que nous n'avions pas assez de moyens. Et puis, on a également organisé des ateliers de formation en faveur des leaders locaux, de déplacer et tout, pour les amener à savoir comment est-ce qu'on peut déconstruire. Comment est-ce que d'abord, quand on reçoit une information, on peut l'analyser, n'importe laquelle, mais surtout dans ce contexte de crise sanitaire, analyser une information et savoir détecter si l'information qu'on a reçue, elle est vraie ou fausse. Dans ce programme, il fallait amener des spécialistes, et notamment des médecins, qui au moins s'y connaissent au sujet de la santé. Ils ont un mot à dire. Ils peuvent expliquer une maladie, la naissance d'une maladie, comment ça vient, par exemple, la pandémie de coronavirus. Il fallait aussi amener des spécialistes. Nous avons, heureusement, au sein de notre organisation, des spécialistes en matière de résolution pacifique des conflits. Au-delà de ça, nous nous sommes dit qu'il serait mieux de leur offrir ce que nous pouvions avoir comme peu pour les aider à affronter cette pandémie. Et en tout cas, je pense que nous avons offert des tiges de savon, nous avons offert de kits de lave-mains, nous avons offert de masques aux gens, aux citoyens les plus démunis. C'est là en vertu de moyens que nous avions parce que nous vivons de contributions de membres de notre communauté locale. C'était ça notre contribution. Il fallait agir à notre échelle et en vertu de moyens que nous avions. C'est des petites techniques qui nous ont aidés à vraiment bien travailler avec les communautés locales.
Such a truly inspiring story from Joseph Songo in the Democratic Republic of Congo about patriotism and taking your social responsibility. Today on Africa Health Check, we're really honored because we not only get to hear from Joseph's story through the feature, but we also have him as our special guest for today's interview. Joseph, hello and welcome.
Hello, thank you.
Take it from the top. So tell us what inspired you to come up with this Amani Institute or initiative from the onset.
Well, so I said that Amani Institute was created in 2013, and it was, the situation in Eastern DR Congo with war since 1994. And we thought that as young people, as I am, and all people around me, we are active and they are using us to destroy. They are recruiting young people in armed groups. And we thought that it was not good. And there was another way to use our energy, our creative sense to build peace and to help our communities and our country, because we know that we are part of the solution that DRC and all the Africa need to recover.
Absolutely fantastic. Getting your peers to not be radicalized into being part of the conflict, but rather being part of the solution and making a difference in DRC. I think that's really powerful and inspiring. I'm also aware that you have a program that is Tupone Wote. Maybe just tell us a little bit about it, and maybe for others like myself who don't understand the language, start off by telling us what does Tupone Wote mean?
So tupone wote is in local language, the Kiswahili is that is mean to heal together. You know, since the COVID-19 pandemic, even before the COVID-19 pandemic, there was Ebola in the region, in our region. Before Ebola and until now, there are violent conflict here in Eastern DR Congo. And we thought that in this period, people will die. And if we don't stand up as young people to try to mobilize local communities and young people also as we are to show them the danger with this sanitation crisis, the COVID-19 pandemic. Firstly, there was a misinformation. People haven't got really or trust information about the pandemic. And we try to ask people to adopt a kind of behavior, to change their behavior so that we can heal together. Because when there is no trust information about the COVID-19 pandemic, about a situation, people can't know how to take the good decisions in their lives. You see.
Totally understand. Maybe just to jump in there a bit, Joseph, to take you a few steps back. You know, you're talking about how you were raising awareness about how to prevent the spread and even getting infected by COVID-19, as well as observing the protocols that have been set. What do you think has been the impact, like, for your communication, the different platforms you were using to really counter misinformation? What do you see, what could you say has been the greatest difference that you have seen in the communities that you reached out to?
The impact or what we saw while leading this campaign is firstly, people was hostile. They didn't even want to hear someone speaking to them about the pandemic, the COVID-19 pandemic, you see. And with those means we use, they try to accept. And there was a little change progressivement, you see. And it was
progression.
Yeah, yes, it was for us as a success, even because what I can add is that people in the region, they don't even trust authorities because of the context, the bad situation, bad conditions of life they are living. But as young people, with that, we know we master the local context because we live in these communities. We know how to go where they are, where people are, which words to use, with whom, and to which place. You see, we try to manage with our creative sense and the courage we have, because we don't have motorcycle or cars as international NGOs, and they trust us.
That's true. So you built the community confidence, basically. It had confidence, the community had confidence in you and the work you were carrying out. I also understand that you have received some sort of recognition for the work that you have been doing with your Dubonewote program. Maybe just briefly share some of the achievements that you have, or the recognition you have received as a result of this program.
As a result of this program, firstly, the big recognition is with local communities, that they accept what we have, show them, and that is the big success we have, or we had in this program, to see people changing their way of living because of our messages in this program. The recognition we received is from a program from the African Union, that they highlighted as among 15 organizations in Africa who was fighting against the COVID-19.
Fantastic. Well, thank you so much for your time, Joseph Tsongo, and congratulations to your organization, Amani Initiative, for being recognized among the 15 organizations in Africa that were active in the response to COVID-19, taking up that social responsibility. Thank you for your time. Keep up the great work. And indeed, Dubonewote, let us heal Africa.
COVID-19 ni ugonjwa tu iliyejitokea bila kujua.
Merci beaucoup par rapport au concept Covid. Covid d'abord c'est une maladie qui frappe souvent les personnes fragilisées d'âge. Ça frappe vraiment des personnes fragilisées d'âge.
Déjà dès le début de cette pandémie, j'étais un peu sceptique par rapport au coronavirus, et cela a fait que j'ai douté beaucoup plus de l'existence de cette maladie. Lorsque la maladie a commencé en Chine, plus tard elle s'est propagée partout, notamment en Europe. Moi je pensais que ça n'allait pas nous arriver ici chez nous en Afrique, plus particulièrement en RDC, à Goma. Voilà pourquoi j'ai douté lorsque nos autorités...
Very interesting views from the word on the street. I think one thing we can definitely all agree on is that it's very, very difficult to control misinformation, or even how information is being disseminated. I'm going to now jump to my panelists, Reverend Achampong, as well as Dr. Marianne. And I'm going to start with Dr. Marianne. I suppose as a healthcare professional, one of your biggest bones of contention is misinformation around COVID-19 pandemic. Maybe share your reflections around this.
Yes, thank you very much. So in terms of misinformation, and also I need to bring in another word, disinformation, for a scientist, this type of information, which is basically false information, can actually cost lives. And I remember in the early points of the pandemic where we were still debating, is it a virus? And if not, what is it? There was this debate that it could be something to do with 5G, something that is controlling population. And there was a lot of misinformation as well about what coronaviruses are. So we've dealt with all those type of misinformation. I remember also when it came to treatment, either it was misinformation that you could steam yourself out of the COVID illnesses, or other misinformation, you could use bleach. There's also use of hydrochloroquine, and recently you could use ivermectin, which we use to treat worms, and also use it in our domestic animals. So all those things used to make us scream, but again, it created a perfect opportunity for us scientists to be able now to clearly state and use in very simple languages what coronaviruses are, the type of infections they cause, how to prevent infections, and also importantly, how to treat and protect those people around you. So we use that opportunity to now inform clearly and make sure we use different platforms to be able to pass our messages across. And I believe this is one of the platforms of how to even prevent and how to use vaccines and how vaccines are saving lives.
Absolutely great. Maybe just a quick follow-up question, Dr. Marian, because, when you're talking about how we've seen stories of 5G and ivermectin trending, I think one of the biggest challenges is that some people bring this information as a testimonial, of something that they experienced. And it's very difficult for you to debate with somebody on something that they say they have experienced. So as a scientist and a healthcare professional, is it still misinformation when somebody is sharing firsthand testimonial, their experience?
Yes, because again, one person's experience could be totally different from a different person's experience. And this is where now we need trust that you trust the person who is giving you this information. And here we are asking our African colleagues, our population, our brothers and sisters, trust us, particularly as scientists who've been studying these viruses, these drugs, hydrochloroquine for many years, and we know how they act, how they react with the body. Some of this information is particularly very dangerous. And now that we have vaccines, use these vaccines to prevent. Vaccines are not dangerous. They do not contain 5G that will be able to track you where you're going. In fact, we've been using vaccines for many years. Our children, our babies, our adults have been using vaccines. So trust these vaccines. There's data. You have to now show real-time data that they're actually saving lives, and we are able to reduce the numbers of the COVID infections and also COVID deaths. Misinformation is dangerous. So we need to be able to counter it with simple language and real-life examples.
That's true. So trust learned experts and not just experts in social media streets and other trends that may be flying through in our societies or circles. I'm going to go now to Reverend Achampong. We are talking about misinformation in response to the COVID-19 pandemic. What can you say is the role of the religious community, particularly in information dissemination, whether positive or negative, but what has been the role of the religious community?
I believe that news circulating on social media and other places, people tend to read into these news. For instance, when people say things like, even the health community, the medical community, there were some news that says that there are real medications that can cure COVID-19, like hydroxychloroquine, ivermectin, and other compounds. Now that becomes a problem for the ordinary people, the illiterate people, because here are elite trained doctors, especially in the United States, who have come together to put out this information. Now, the ordinary person on the street doesn't know which is true, which one is true, whether Christian or non-Christian. So it becomes hard for the common person on the street to check. That might account for some of the vaccine hesitancy, with nations and with people. So I do believe that, like Dr. Marianne is saying, there must be a lot of education and emphasis. Maybe the right information needs to come out there, because the same medical people, one group is saying this and the other group is saying that. There is confusion in the market. Imagine.
Absolutely true. There's so much confusion. And talking about the confusion, and I think either of you can take this question. Why is it so easy for misinformation, unverified sources, and any piece of information to go viral, to trend, or even reach masses more than the accurate and verified information?
Well, I'll take it up. It's partly because there is no body There is no particular group of people that have the ultimate final word on what is true and what is not true. There is no censorship on the social media whose word carries the day.
Absolutely. And I think maybe just to be fair, I think this pandemic also came as a shock to many, many people agenda. But I want us to use this moment now to get the facts from Dr. Marianne.
So, yes, so again, and I really appreciate what we are discussing at the moment. Yes, there is that mistrust, and there was a vacuum that was left. That who do we believe? What do we believe, and what is right? And this is when I believe that now we have mechanisms, we have platforms, we have even social media influencers who we can now leverage on to pass the correct message. And as long as we keep this message simple, first of all, what is the coronavirus? How is it spread? And with that way, how do we prevent it? Washing our hands, wearing masks, social distancing. We should not forget the simple, clear messages, and then support them with clear imaging, support them with clear data that actually they're preventing the spread of the virus. And then how do we treat this virus correctly and effectively? Again, using simple language, having medics in these discussions, in the newspapers, on radio platforms, on social media, discussing how they are treating and their successes and how they're using these successes to be able again to prevent these infections within their platforms, and then making sure that we are also taking a responsibility to these people who are spreading misinformation.
Absolutely great. Thank you very much for that, Dr. Marianne. And maybe just briefly, in just 30 seconds, from your experience, what has been the biggest misconception about COVID-19?
The biggest misconception, first of all, was, is it a virus or is it a way to control our population? Two, the other misinformation was the vaccines are fake. Again, there's something in these vaccines that maybe they're going to, again, prevent us, make us infertile or make us control our population as well. And that really used to infuriate me. But I've learned now how to, again, keep the message simple, show them, again, this is what we've been studying. These are virus, these are viral infection, these are vaccines. You've been having vaccines for many years. They have been successful, and there's nothing wrong with the COVID vaccine. When I got my shot, made sure that I used my own social media platforms to educate people. I tracked how many days I had any reactions. I had none, and I had a very good engagement with everyone on that platform. So again, keeping our messages simple, making sure that we are communicating, constantly communicating, and using the right platforms to do that.
Thank you very much, Dr. Marianne, Reverend Anthony, as well as Joseph Tsongo, for your time today and contributing to this discussion. I believe somebody has been empowered through your words and your sentiments. There's a saying that media is a very powerful tool simply because it covers the masses, or it reaches the masses. And I just want to implore everyone who's listening to this that please be careful what you put on the media, the information that you share or repost. Sometimes it's an issue of life and death for somebody who be consuming that information that you have shared. Sometimes it's better to say nothing at all if you are unsure about what you want to share or communicate. So let us be very sensitive and cautious, and also cognizant of the fact that sharing wrong information is actually a criminal offense in certain countries. So I wouldn't want you to end up on the wrong side of the law in your country. That's it for today's show. Catch us next week, same time, same place. This is Africa Health Check. Make sure you follow us on social media to stay connected. Until then, remember that the future is Africa, the future is today.